Tests of ability in psychological work. Introduction. Determining the extent of one's abilities, particularly cognitive and analytical skills, represents a critical step in a range of strategies within the field of social work. Therefore, the application of an appropriate test type and an adequate assessment of results may predetermine the outcomes of an intervention and the extent of an individual's recovery. The concept of the test of ability can be summarized as a set of questions aimed at detecting an individual's extent of cognitive skills and evaluating the individual's capability of applying these skills to solve problems. Overall, tests of ability represent a crucial part of a therapeutic framework for addressing the needs of all types of clients. Tests. Though tests of ability may vary extensively based on a specific issue that they are used to determine, as well as the information that a social worker seeks to obtain, there is a general categorization approach allowing identifying essential types of tests of ability. As a rule, tests of ability may be represented by quizzes checking an individual's reasoning, including numerical, verbal, mechanical, and spatial, abstract thinking, situational judgment, and concentration. The assessment instruments used within the specified categories often overlap, being represented by multiple-choice questions, questionnaires, and Likert scales. Similarly to Likert scale questions, multiple-choice options provide easily quantifiable results. In contrast, questionnaires offer information that is significantly more detailed. Use. Within the category of assessment, utilizing the tests in question to identify an individual's mental capabilities and the existing challenges that may obstruct the introduction of a specific therapy would be an example of appropriate use. In turn, inappropriate use of ability tests may involve the selection of tests for children with information processing issues to determine the extent of their cognitive development. In the specified scenario, if the difficulty of questions does not represent the required level, it will fail to evaluate the client's skills properly. For instance, choosing questions that are uniformly difficult or excessively simple would be applying the tests of ability inappropriately. Similarly, ethical and cognitive issues may occur when administering tests to members of diverse communities. For example, the presence of a language barrier may impede the process of assessment. Furthermore, among core debates within the specified area, the development of ability tests for individuals with impaired cognitive skills represents a contentious topic. By choosing tests in a manner that aligns with the client's current skill level and development stage, one will obtain the results that will inform the selection of a relevant strategy for managing specific issues. Format. The formats that can be used to administer ability tests are sufficiently varied, which offers a social worker impressive flexibility. As a rule, multiple-choice quizzes are used to check an individual's skill range. However, an ability test may also be represented by an open-ended question or a problem that must be solved by providing an accurate answer. Professional integration of testing and assessment data allows an expert to determine gaps in the client's mental skills range effectively. To validate different types of testing within a psychometric category, instruments such as the discrimination index are typically used. The specified tools allow for obtaining accurate and nuanced details concerning a client's score, which makes them exceptionally helpful. Furthermore, the broad range of score types offers to gain different data types. For instance, Likert-type questions allow placing the client's results on a spectrum. The percentile rank shows the extent of the client's alignment with the desirable outcome, and age and grade equivalence demonstrate the extent of deviation from the norm. Conclusion. When performing the assessment, one must be aware of the core terminology used in the process. For example, the IQ, or intelligence quotient, is a quantitative characteristic of a client's cognitive and intellectual skills. Categories of intelligence represent different domains of cognitive skills and their use. Finally, the term ID is often used to refer to the problem of intellectual disability in individuals.